Today we have some new data to show on the effectiveness of the vaccine, both its real-world effect that we can now see in the data and some new analytical research that we're publishing that shows how it's saving lives. And this is being published in a paper by Public Health England and others right now. First, let's look at the real-world data. Next slide, please. If you look at the number of new cases, as we described on Friday, the number of new cases is falling, but the rate of decline has slowed. This shows how we all need to keep sticking to the rules. Let's not blow it now. However, next slide, please. The number of hospitalisations is falling faster. Even better, among the age groups who were vaccinated first, so the older age groups, the fall in hospitalisations is faster than in the younger age groups who are still yet to get a jab. This is a sign that the vaccine is working. Next slide, please. But where you can really see it is in the data on deaths. We can see that the number of deaths each day is thankfully falling much, much faster than in the first peak. And again, as you can see from this slide, it's falling faster in the over 80s, who got the jab first, than in the under 80s. Final slide, please. And taken together, this difference in the data between older and younger groups shows a vaccine gap. And you can just see it starting to emerge here over February. This is a gap between the rate of decline in older and younger groups, where the older groups were obviously vaccinated first, and you're seeing that the rate of decline in terms of the number of people dying each day is going faster amongst the over 80s. And this shows in the real world across the UK right now that the vaccine is helping both to protect the NHS and to save lives. And these real world effects are backed up by some exciting new data that shows that a single shot of either the Oxford-AstraZeneca vaccine or of the Pfizer vaccine works against severe infection among the over 70s with a more than 80% reduction in hospitalisations. This is extremely good news. In fact, the detailed data show that the protection that you get from catching COVID 35 days after a first jab is even slightly better for the Oxford jab than for Pfizer. Albeit both results are clearly very strong, and Professor Van Tam is going to set out more details in a moment. These results may also help to explain why the number of COVID admissions to intensive care units among people over 80 in the UK have dropped to single figures in the last couple of weeks, which is something I know that we all welcome. This is seriously encouraging. It shows the power of science, and what it means for you is that when the call comes, get the jab. The evidence shows that it will protect you and protect others. And I can formally announce that we're now inviting the over 60s to be vaccinated, all part of our national effort to ensure everybody is offered the vaccine, every adult, by the end of July.